Hello, everyone, and welcome to today's presentation, Supporting 988 Post-Launch Through Federal and State Advocacy. This is the second webinar in AFSP's The State of 988 series, and is a feature part of our overall September Suicide Prevention Month activities. Thank you so much for joining us. My name is Nicole Gibson. I am the Senior Director of State Policy and Advocacy with the American Foundation for Suicide Prevention, or AFSP. I am so pleased to introduce to you today several incredible speakers and colleagues who are our go-to experts on all things 988. Megan Cole is AFSP's Area Director for the state of Kentucky. Taylor Kleffel is AFSP's Senior Manager of State Policy. Jordan Pantalone is Manager of State Policy at Vibrant Emotional Health. Stephanie Pasternak is the State Affairs Director at the National Alliance on Mental Illness, or NAMI. And Joanna Rosen is AFSP's Manager of Federal Policy. Together, we will be sharing what advocates need to know about the Lifeline and its recent transition to the 988 dialing code. We'll then go into a more detailed discussion about what 988 is and isn't, federal and state progress on 988 and current advocacy efforts, a case study from the state of Kentucky on what effective 988 advocacy can look like on the ground, and a review of the Lifeline's privacy policies and imminent risk protocol. We'll close with providing some tangible next steps for you, our suicide prevention advocates who wish to begin or continue your involvement in advocating for 988 in your state. Throughout the presentation, please feel free to ask questions in the comments section. There is no live Q&A with our speakers today. Instead, our staff will respond virtually to as many questions as possible in the comments. You can always contact us at advocacy@afsp.org with questions or comments as well. With that, I'll begin with a quick snapshot of the 988 Suicide and Crisis Lifeline. This is the official new name and number for the network of crisis call centers that make up what used to be called the National Suicide Prevention Lifeline, and what used to be accessed by dialing the 10-digit 1-800-273-TALK number. The much shorter 988 number now connects individuals throughout the United States to that same Lifeline network, which provides immediate 24/7 crisis care via call, chat, and text. The Lifeline is for individuals who are in crisis themselves, and it is also for individuals who may be worried about someone else who may need crisis support. And the Lifeline helps thousands of people who are struggling overcome crises every day. I mentioned that the transition to the new 988 number was recent. Congress and the Federal Communications Commission, or FCC, officially designated 988 as the 3-digit phone number for the Lifeline back in 2020, and said that the number had to be available nationwide by July 16th of this year. That means that 988 has been available everywhere in the US for a little over a month now. It also took several years of advocacy, even before 2020, to get to this point. This slide shows a more detailed history of the Lifeline's transition, beginning back in May of 2017, when a bill called the National Suicide Hotline Improvement Act was introduced. Passed by Congress a year later in 2018, this bill directed the FCC to report on the feasibility of designating a 3-digit number for the Lifeline. The FCC ultimately determined that 988 would be the best number for that a year later in 2019, but it took yet another year before the 988 number was officially designated by both the FCC and Congress, and then 2 more years to get us to now, when 988 is actually available across the country. As you can see, there were 2 major federal bills, several reports, and numerous hurdles to clear before the 988 number itself became a reality. Thank you to all of our advocates who helped play a part in this process. And it will be years still before the full vision of 988 is realized, which we will get into more later on in the presentation. We felt it was important to give some basics about what 988 is and is not, so that we can all gain a common understanding, and so we can begin to talk about 988 in similar ways, which will help amplify our advocacy messages. First and foremost, 988 is still the Lifeline and connects you with the same Lifeline network, but we can now use a much easier to remember number. The 10-digit number will also continue to be active. It just won't be promoted anymore. 988 is still a crisis service for individuals at risk for suicide, but with the transition, the Lifeline has now been expanded to officially address mental health and substance use crises as well, which you can think of as any situation where someone is at risk of hurting themselves or others, or where they can no longer function well in the community. And importantly, 988 still connects you to a national network of Lifeline crisis call centers. The change that occurred with passage of one of those federal bills I mentioned, the National Suicide Hotline Designation Act in 2020, is that states can now put fees in place to fund 988 in the same way that 911 is funded, through small service fees on your cell phone bills, typically less than $1 per month. Encouraging more states to implement these fees is a top priority for AFSP and many of our partners, and we'll get more into this later on as well. The transition to 988 has really put the spotlight on suicide prevention and mental health, and leaders from across government are now speaking out about the importance of prioritizing crisis care. We've included here just a few quotes from U.S. Health and Human Services Secretary Becerra, who said that 988 is more than a number, it is a message. And he's meaning a message to the public that help is available and that there is hope. He also says that the Lifeline's ultimate success will hinge on the states owning 988. In other words, that it will ultimately be up to the states to continually support their crisis centers and build out their response services to serve all residents in need. With this increased public attention on 988, it is also important to draw distinctions between 988 and other emergency, emotional support, and referral services. On the screen here, we've highlighted the differences between 988, 911, warm lines, and 211. What adds a layer of complexity here is that the same call centers, in some cases, might answer calls from both 988 and 211, or 988 and a warm line number. However, the services provided when calling those numbers, even if provided by the same center, are distinctly different. You now know that 988 is available for individuals experiencing a suicidal, mental health, or substance use crisis. Lifeline call centers are staffed by trained crisis counselors who provide support and attempt to de-escalate the crisis over the phone. In most cases, the call is the intervention, and in-person response is not needed. In the small percentage of cases where in-person response is needed, the counselor will connect callers to available community crisis services. Advocacy efforts are ongoing to build these out, which Taylor will talk about momentarily. Warm lines are for individuals who are in distress, but they are meant for more early intervention. In other words, before someone gets to that crisis point. And 211 generally serves as an information, resource, and referral line for people who need help with meeting basic needs like housing, food, and other health and social services. In contrast, 911 is for life-threatening health and public safety emergencies. Anyone experiencing an emergency that requires immediate medical attention, and that includes a suicide attempt or a substance overdose in progress, should immediately call 911. This connects you with an emergency dispatcher who collects information and then sends emergency medical services, fire, or police to provide the life-saving interventions that are needed. The person answering the phone does not provide the intervention like they do when you call 988. We'd now like to get a little more into the distinction between 988 and 911, more than what you see here on this slide. And for that, I will turn it over to my colleague, Taylor Cleffel.
Thank you, Nicole. I want to start off with the distinction between 911 and 988. So, a key issue or question that often comes up in educating people about 988 is what is meant when we say it's an alternative to 911 and helping people to understand when to call 988 versus 911 or other emergency services. So, the first thing I want to emphasize when talking about a 988 response versus a 911 response is that the large majority of calls to the Lifeline are stabilized over the phone, so that an in-person response is not required or automatically dispatched, unlike when similar calls are made to 911. There are, of course, some situations in which crisis centers must work with emergency services to ensure the safety of a person who is in immediate danger. But the reality is that these instances are rare and only occur when the caller is at the highest level of risk, resulting in fewer than 2% of Lifeline calls requiring in-person emergency response. Now, for this reason, individual calls to 988 often take much more time and support than a 911 call because much of the de-escalation and stabilization of the crisis occurs over the phone rather than through an in-person response like police, EMS, fire, or others. Still, for those certain situations where additional services are needed, the people answering 988 calls are trained to ensure that those needing more support receive appropriate mental health or wraparound services. However, and our other speakers will also talk about this more throughout the presentation, and Nicole mentioned this as well, this can only happen if states have in place the infrastructure to ensure that connection to the broader crisis care continuum is made. While ideally any in-person response to a 988 call would be from professionals or trained peer support specialists, if those services don't exist, then it is more than likely that a 911 dispatch will occur. With that said, I do also want to note that because services are limited in some states and communities, and because there are cases in which an EMT emergency response is also needed, it is still important that 988 and 911 systems in every community are closely coordinated to increase the likelihood that callers receive appropriate care and that the first responders are aware of the unique circumstances that come with each crisis encounter. So 988 is an opportunity. What does that mean? In the long term, 988 is more than just a 3-digit number. It's about creating a system of appropriate and effective services and providers that is able to connect people to a continuum of crisis care at critical moments. What does that mean? An effective 988 crisis response infrastructure includes 3 main components. Someone to talk to, so those are the 24/7 crisis call centers in your communities. Someone to respond, those would be the mobile crisis response teams, and somewhere to go, crisis respite and stabilization centers. So as Nicole spoke about, while federal action created the 988 number, a community's response to people in crisis depends on state action. Right now, there is a very wide variation in what mental health crisis services are available where and who can access them, both across the country and within each state, rural communities versus urban communities. We know that mobile crisis response is crucial for the state level implementation of 988. States need the capacity to properly respond when callers to 988 need in-person interventions. Mobile crisis interventions have been shown to be cost-effective, effective at diverting people in crisis from psychiatric hospitalization, effective at linking suicidal individuals discharged from the emergency department to services, and better than hospitalization at linking people in crisis to outpatient services, including crisis stabilization. Also, as we continue to build out the system, the fact that crisis response without the involvement of behavioral health professionals and paraprofessionals often places historically marginalized communities at disproportionate risk of harm and poor outcomes must be at the forefront and considered in each decision and action we take. Of course, all individuals in acute distress or experiencing a behavioral health crisis should receive equitable and appropriate responses and care wherever they are, separate from emergency medical or law enforcement intervention. So we really need to think about those communities, and that should be weaved into everything we do. Next slide, please. So it is very important to remember that this is a process and it will take time. Such significant structural and societal changes do not happen overnight, and that's why 988 will remain a top priority of AFSPs and our partner national and state organizations, and why we must ensure state legislators and state agencies know the work is not done. It took decades for 911 to turn into the service we know it as today. 988 doesn't have to take that much time as long as we stay active and keep the momentum and public awareness. So while there has been a lot of progress made, we must stress to states that their work isn't over until funding is adequate and sustainable, and that progress is ongoing and must continue. For example, many states were able to designate ARPA funds to 988, which was very important to make sure their local call centers and services were prepared and well-resourced ahead of the official launch and in anticipation of the increase in volume over the first couple years. But in many cases, budget funding is one time only or only covers a set number of years, and therefore it's not sustainable. Throughout the rest of the year and in the coming 2023 legislative sessions, AFSP will once again prioritize 988 and the model legislation, which I will talk about shortly. We will still highlight 988 at our state Capitol Day events, continue to collaborate with our partners like Vibrant and NAMI, and activate advocates to take action by calling or emailing their legislators, holding meetings with their state agencies, providing testimony on legislation, and other activities to pass even more funding and infrastructure legislation. It's also important to note that until a fully implemented 988 crisis response system can be realized, we must continue recent efforts that we've seen bills being introduced across the country that require we train law enforcement and other first responders in mental health, suicide prevention, and crisis intervention. We've seen a lot of this legislation introduced to do just that over the last couple of years, many of which have been enacted, and AFSP will continue to support that type of legislation. And then finally, we also will still be continuing our basic education efforts to ensure the right information is getting into the hands of legislators and that the public understands its purpose, the purpose of 988, so it's used to its full potential. While we may have been following the progress of 988 for a long time now, most of the public is still not aware of 988 or maybe misinformed on it. So it is essential we continue to work with the media and community leaders to first just let people know 988 is a resource, but also to ensure there is a consistent message about what to expect when dialing 988. It's important to remember marketing and communications will be ongoing efforts. However, they should not hold up passing 988 legislation funding or implementing the crisis services our community needs. These things can be done, together. And with that, next slide, please. So I'm going to talk about the state efforts that we've seen over the past couple of years and kind of where we're going. So since 2021, 16 states have passed some version of 988 legislation, including bills to implement a 988 fee or build their state's crisis infrastructure, appropriating funds for 988 related services. So you will see here, if you look at the map, and we will also be providing this afterwards as a handout, but there are states that passed a bill without a fee. So this might be that they set up infrastructure, they created a work group on 988, or there was a directive for studies and reports on how to fund and supplement 988. There were also several bills that were enacted with a fee. So Colorado caps the fee at 30 cents, Nevada at 35 cents, Virginia set their fee at 12 cents for wireless, 8 cents for prepaid. Washington has a 24-cent fee through the end of 2022, and then it will rise to 40 cents. And also California, which is on the governor's desk now, and hopefully we will see that enacted soon, also includes an 8-cent fee. And then you will also see here, there are active bills that have a fee. We have Massachusetts, Michigan, California, like I mentioned, and Minnesota. And then there were a lot that were introduced that unfortunately did not pass. And you'll actually hear more about that in a state like Kentucky, but hopefully we can, come back next year and get that reintroduced. And then I also wanted to mention that several states passed legislation to include 988 funding in their state budgets. And so at this point, the majority of states across the country have taken some action to support 988. Next slide. So we have endorsed the Model 988 implementation bill, which was put forward by the National Association of State Mental Health Program Directors. And this is something that we've provided input on along with, NABI, Vibrant, and other related groups. So it's that full continuum crisis of care, making sure there's that coordination that I talked about across emergency response systems, whether that be 911 or 211, warning lines, and other resources available in each community. There is the data collection and reporting so that we can see how effective 988 is being, where we might need more funding, making sure it's being used properly. And then, of course, the big key one is that funding mechanism, ideally through a telecom customer service fee. And although we've only had that in a handful of states, like I said, there has been a lot of funding, but that is the ultimate goal. And I am going to pass it over to Joanna now to talk more about our federal advocacy efforts.
Thank you so much, Taylor. So for the last several years, AFSP has been at the forefront of advocating for 988 supports at the federal level. And I'm just going to go over briefly what that looks like, what we've been up to on the federal side, and where we need to go to make 988 the strongest and most efficient crisis response system that it can be. AFSP advocates for federal funding for 988 through several avenues so that the Lifeline can continue to provide and expand on its life-saving services. The first way that we advocate for and obtain funding is through the annual budget process, which happens once a year and during which Congress and the presidential administration determine how to distribute funding across numerous priorities. For the most recent budget, fiscal year 2022, $102 million was set aside for Lifeline operations. And this is a significant increase up from $24 million the previous year. The second way that we make sure that 988 is adequately resourced is by advocating for specific bills. Now, these bills that we choose to advocate for will provide funds to the Lifeline networks. One example of successful advocacy in this area is the Bipartisan Safer Communities Act, which, as you probably know, was recently signed into law, and it provides an additional $150 million for Lifeline operations on top of the FY22 funding levels. As Taylor mentioned previously, the American Rescue Plan Act, or ARPA, is another example, as it included $180 million, which was used by the Substance Abuse and Mental Health Services Administration for the Lifeline's expansion as well. Now, the funding from these streams, both budget and legislative, goes to both the local and crisis call center, the local crisis call centers in the states and the national and backup networks. This funding is used for call center resources, chat and text capacity, infrastructure for the centers, training and salaries for staff, and supports for the workforce. For the states, SAMHSA estimated in 2021 that about $105 million is needed to fund local call centers. Currently, this $105 million is dispersed through grants from SAMHSA to call centers in each state, with the remainder going to strengthen and expand the existing Lifeline network operation and infrastructure of the national and backup call centers. Next slide, please. Although 988 has been implemented and is available in all states, there is still a lot of work to be done when it comes to making sure it has enough resources and funding. So from a legislative perspective, AFSP is currently working to encourage passage of several important 988 bills. Both of these bills that you see on the screen are bipartisan, and AFSP is prioritizing them right now. The Suicide Prevention Lifeline Improvement Act sets standards for call centers to improve responsiveness and expand supports for callers. It reauthorizes and funds the Lifeline through fiscal year 2027, so it sustains and maintains that funding. It also calls for an awareness campaign so that people are educated about when calling 988 is necessary and appropriate, and what resources are available through 988. Additionally, it calls for improved data collection and analysis of Lifeline usage so that we can see how the Lifeline is doing and can determine what work should be done to improve it. This bill was introduced by Senators Jack Reed and Jerry Moran, and it's passed through the House already and is currently in the Senate Health, Education, Labor, and Pension Committee. And we want to see it pass in the Senate and be signed into law before the end of the current Congress's session. The other bill that we're pushing right now, the 988 Implementation Act, provides important investments into the 988 Lifeline to build out the infrastructure of 24/7 call centers, mobile crisis teams, and crisis stabilization facilities. It also ensures the creation of and funding for a Behavioral Health Crisis Coordinating Office to act as a national resource for Lifeline networks. And it expands Medicaid coverage for crisis services and offers supports for the behavioral health workforce. This bill was introduced by Representative Cardenas and has many co-sponsors. It's in the House at the moment and is currently in the House Energy and Commerce Committee and the House Ways and Means Committee, along with several others. Like I said, it has broad support and many co-sponsors, and we really hope to see it pass through the House soon. You can visit our Action Center on our website to participate in our Action Alert by reaching out to your members of Congress to urge them to support these important bills. Next slide, please. We also support several other bills listed here that would enhance 988 and Lifeline operations. S1902 would expand crisis services and ensure standards of care across the crisis care continuum. HR 2862 would create and fund a national awareness campaign to educate the public on 988. And again, you can read more about these and other bills that revolve around 988 and crisis lines on our Action Center as well. Next slide, please. In terms of the budget, currently we're awaiting Congress's final budget for fiscal year 2023. AFSP has been advocating for the inclusion of funding for 988 and crisis services, and we've met with members of the appropriations committees in both the House and the Senate to request $697 million for 988 and crisis services. This funding would go to sustaining and expanding the Lifeline, as well as the broader crisis care continuum, which again includes mobile crisis response teams, crisis stabilization facilities, as well as other important wraparound services for anyone in crisis. This matches what the president outlined in his budget proposal for FY23 for funding for 988 and crisis services. The Senate budget draft has matched this request, while the House has actually surpassed it by including $747 million for 988 and crisis services, which is really gratifying to see and very encouraging when we think about next year and the increasing use of the Lifeline services. We know that the new 3-digit number is already driving usage up, so increased funding is extremely important to make sure that the Lifeline can match the needs of its growing number of callers. We await a final budget for FY23 and hope that the president can sign it quickly. But in the meantime, we're already beginning to look towards FY24, and AFSP will continue to advocate for increased funding to address the ever-growing demand for 988 and crisis services, so that anyone in crisis has someone to call, someone to respond, and somewhere to go when they need it. Now I'll turn it over to Megan to discuss Kentucky's work on 988.
So to get started on talking about 988 Kentucky, I wanted to give you a little bit of background of where we started in Kentucky. Next slide, please. So we received federal funding in late 2020, early 2021 to create an implementation coalition and plan for 988's rollout, as many states across the country did. So our state suicide prevention coordinator formed a really robust, well-rounded, diverse coalition of stakeholders throughout the state so that we could have a fully informed implementation plan. It included representatives from the 911 Services Board, from our agriculture community, different mental health agencies and nonprofits, our community mental health centers, people with lived and loss experience, to make sure that we really thought about everything and anything when it came to 988's rollout. At the time when we started the coalition, the National Suicide Prevention Lifeline was answered by 10 of our community mental health centers that provided services on a regional basis. And at this time, 13 of our 14 centers are fully onboarded to support the Lifeline. Next slide, please. So early on in the coalition, really meeting one, we realized that we were going to have to create a separate coalition to focus on advocacy. We had so many government agents and representatives involved with the implementation coalition that are not allowed to participate in the advocacy process. So myself and the executive director of Mental Health America of Kentucky formed the Fund 988 Kentucky Coalition. We invited stakeholders from the implementation coalition to be a part of this, those who were able to participate in advocacy. And both her and I remained on the implementation coalition so that we could continue to help support the rollout and be advised from them to make sure that any legislation we were putting forward made sense with the rollout plan. So we introduced a bill very late in 2021 session. We knew that this wasn't going to go anywhere. We worked with a partner that we'd worked on other bills with, but we wanted to use this opportunity to get an early start for the 2022 session. Having this bill introduced in late 2021 gave us the ability to go ahead and start having meetings with different representatives to start educating about 988. That July 2022 date seems so far out at the time, but we knew we needed to get a really early start on informing the General Assembly about what to expect in our funding needs. Then the bill was able to be introduced early in the 2022 session, and it picked up a lot more momentum because of that early introduction. So some advocacy wins that we saw this year was House Bill 373. This was a very thoughtful bill. It was put together based off of that model legislation that we've endorsed, as well as looking at the bill that created 911's funding streams. So we made it very specific to Kentucky. This did get stuck in the Appropriations and Revenue Committee, and that gives us an idea of members of our General Assembly that we need to target next year. But some of the takeaways and wins from this, we really built up a strong coalition for funding 988 and making sure that we were filling in gaps and bringing everybody to the table. We were able to recruit 14 bipartisan co-sponsors, and we just hosted so many meetings with representatives and senators all over the state to discuss concerns with the bill, to talk about constituent needs, and to really educate them on 988 and what the implementation coalition is doing and our vision for the future. And it helped plant the seed for 2023, hopefully. We were able to secure funding for 988 in the state budget as well. This was huge because this gives our community mental health centers that initial funding to really help build capacity over the next 2 years. But we know that this is not going to be enough. A lot of times when there are budget cuts in the General Assembly, mental health services are the first to go. So establishing that fee is still a priority. We want to make sure to let our representatives know that this isn't an either or thing. We'd like both and to ensure consistent funding for the community mental health centers that answer the lifeline. And then we really did an excellent job of raising awareness and strengthening our legislative relationships, as well as adding new relationships in. Next slide, please. We also learned a lot of lessons. We need an earlier start. Our goal this year is to pre-file the bill so that there can be a lot of awareness around the bill coming, and it can be made a priority for the 2023 session. We also want to be strategic about who leads the bill. Kentucky has a Republican supermajority, and while we did have a Republican introduce the bill this year, she is seen a little more as a centrist. So I think we need to target somebody that's a little further right and maybe on the Appropriations and Revenue Committee so we can ensure that it doesn't get stuck in committee again. And then we want to have specific and united messaging around the bill, not only for our advocates, but for the general public, as well as the General Assembly and our representatives and senators. So some of that clear messaging that we've put together is that we are asking for a 70-cent fee per mobile line in Kentucky, and this is consistent with 911. 911 has a fee on other lines such as landlines and fax lines and things like that. We're just looking for parity with their fee on mobile lines. We're also emphasizing that not only are we anticipating and already seeing more calls since the rollout of 988, but since the start of pandemic, we've seen a greater intensity in calls. So there's an even greater need for more call takers to ensure we don't have any call taker burnout and to ensure that calls are able to be answered in Kentucky. We're emphasizing that there will be an oversight board to help manage the distribution of funds going forward. And we have key stakeholders from around the state to help ensure that the funds are used appropriately. We're also some additional information, just because we've gotten these questions a lot, is that very few calls require any sort of first responder response from ambulance, fire, or police, and that most callers are able to talk with crisis counselors and then receive non-emergency follow-up services. 80% of calls in Kentucky are answered in Kentucky by our local community mental health centers. That number has gone down slightly since the rollout of 988, and that's going to be a talking point for next year too, to show that the increased amount of calls is affecting our in-state answer rate. When somebody in rural Eastern Kentucky calls, they want to be connected with somebody in their region, so we're really emphasizing that in our discussions as well. And that local answers mean local resources and seamless connection to any sort of follow-up services. We are also heavily focusing on fee versus a tax. This is a fee, which is very tightly defined. The funds are used for very specific purposes. That's why we have the distribution form to ensure they're being used for what the bill says they're going to be used for. A lot of our elected officials run on platforms that they're not going to raise or add any taxes. So it's really important that we clarify that this is not a tax. A tax can be used for general usage, and it can be redistributed somewhere else in the budget where this fee cannot. Our four main talking points that we have been equipping advocates with is focusing on parity with 911. Kentucky had a mental health parity bill go through in the last few years, so we know that the General Assembly is already informed on this topic. So So we're really focusing on parity with 911 and that we're working with the 911 Services Board on the implementation and rollout of 988. We're also emphasizing that this is federal guidance from the Trump administration, that this passed our Congress unanimously in 2020, which did not happen much in 2020, and that there was widespread support at that time, even from the telecom industry. We're again emphasizing the fee, not a tax. I can't emphasize that enough, and that's something that we're really ingraining in our advocates, as well as any of our elected officials who are helping to recruit their colleagues to support this bill. And then that funding is urgent. 988 is here, and people are calling it, whether or not we have the people to answer it. So it's really important that we have consistent, sustainable funding streams in place to support our community mental health centers and make sure that they're fully staffed. Some of the tools that we focus on is building up that Fund 988 Kentucky Coalition. We're focusing on having consistent meetings as well as communication in between those meetings. Each person on the coalition has specific connections and specific roles in Kentucky. So we are doing a lot of specific asks of members of our coalition to have them either recruit for any gaps that we have in the coalition or to set up meetings with representatives. And this has been a really powerful tool. We've also created a Fund 988 Kentucky landing page that we're keeping updated with different resources that SAMHSA is providing, as well as any legislative updates and moves. And I think the most important aspect of this is we have multiple sign-up sheets on this landing page, one for individuals to sign up to stay connected and get updates on what we're doing with Fund 988 Kentucky, one for businesses, organizations, nonprofits to sign up to voice their support for 988, and then an application for other people to join our Fund 988 Kentucky Coalition. And then we're really leaning into existing partnerships, motivating our previous sponsors. These people who signed on really early to support the bill, they're passionate about 988 mental health and suicide prevention. So we really want to utilize that to help grow our sponsor support in the General Assembly next year. And then our plans for next year's session, we know that we have to fund that continuum of care. So we've really done a great job of educating on 988. Now we want to focus on educating on that someone to call, someone to respond, someplace to go piece. So having our call centers fully staffed is one step of the process, but we also want to have those mobile crisis response teams that are equipped to respond to different scenarios. We don't want to send first responders who aren't specifically trained in mental health crises to respond to this. When you need a plumber, you don't want an electrician to come to your house. So that's kind of messaging that we're doing surrounding those mobile response teams. And then crisis stabilization services that can connect people with follow-up care. So that is kind of our plan for the next session in Kentucky. And now I'm going to hand it over to Jordan.
Thank you very much. Really appreciate the opportunity to be here, talk about this extremely important issue. I think we've seen a lot of communication around this since the launch of 988, some confusion around the Lifeline's policy on privacy and imminent risk. I'm hopeful that I can provide some clarity and context around this conversation. So thank you again. Next slide, please. Just a quick disclaimer. These views do not necessarily represent SAMHSA. I'm speaking on behalf of Vibrant and the Lifeline. Next slide, please. So just some core principles that I think help set the stage for this conversation. The Lifeline is committed to promoting emotional well-being for everyone, anywhere at any time. We work 24/7 to save lives and assist those in need. And we truly have an unwavering belief that we have to do everything we can to save a life to our most vulnerable. The primary mission of the Lifeline is to prevent the suicide of its callers. Crisis center staff have to undertake necessary actions intended to secure the safety of those callers determined to be attempting suicide or who are at imminent risk. Next slide, please. So I also just want to provide a little context too about how we come to not only our imminent risk policy, but our policies more broadly at the Lifeline. So on the top right-hand part of your screen there, you see those kind of blue arrows. We have our Standards, Trainings, and Practices Committee, our Lived Experience Committee, and our Steering Committee. Those three groups really help identify, what those policies are for the Lifeline. I won't go through this in a ton of detail, but you can kind of see here it gets kind of passed down to staff. Staff is responsible for implementing, creating training for the crisis centers, evaluating its effectiveness, and in revamping it as we need. So next slide, please. So a little more context, just thinking about this, taking a step back. We know that the Lifeline is extremely effective, at helping callers in emotional distress. For the overwhelming majority of folks who call the Lifeline, those calls are resolved without any in-person intervention required. And I know we've kind of said this number before, but it is worth reiterating that less than 2% of those Lifeline contacts end up involving emergency services. And in those rare instances where emergency services are needed, more than half of those happen with the caller's consent. So just another way to reframe that 2% number, about half of those instances happen with the caller's consent. Next slide, please. So now I'll talk a little bit about our policies on involuntary emergency intervention and talk you through a little bit about what the crisis counselors are trained to do. So, our counselors are trained to actively engage the individual at risk, discussing their thoughts of suicide and really, establishing a relationship and a bond and an alliance through listening and understanding. Our current policy requires those crisis counselors to include the caller's wishes, plans, needs, capacities towards, acting on their own behalf to reduce that risk of suicide. It is our recommendation to crisis counselors and to crisis centers that they only contact emergency services for assistance in cases where the risk or harm to self is imminent or may already be in progress. This assumes that less invasive methods have already been looked at and have not been deemed successful. Next slide, please. So crisis counselors look at four things when identifying risk. So suicidal desire of the caller, suicidal intent, suicidal capability, and if there are any buffers, is there anything preventing it from happening? It is our protocol to use the least invasive method possible. I kind of alluded to that on the last slide, but we really view, involving emergency services as a bit of a last resort. That said, that's not to mitigate anything. We understand that there are individuals and communities who are much more likely to have a traumatic or even, dangerous experience when emergency services, particularly law enforcement, are involved in that process. Next slide, please. So as I mentioned, it is our protocol to offer or to suggest other services prior to engaging emergency services. And I think most notably, that's probably mobile crisis teams. And again, just to reiterate, emergency services, law enforcement is a last resort. And some folks here have kind of already alluded to this and discussed about the need for, a fully funded and a robust crisis continuum. But I think this is a prime example. If you have fully funded mobile crisis teams, the need for law enforcement to be engaged, in these mental health emergencies is really taken off the table, or is at least less prevalent. I think this is something you see particularly true in rural communities who are less likely to have access to these, fully funded mobile crisis teams and these fully funded mental health programs. So again, just the need for that robust crisis continuum is just essential. Next slide, please. Okay, so a little bit behind the logic behind involuntary emergency intervention. And I'll start kind of just giving a definition of that because I think it's important here. So that involves counselor actions on behalf of individuals who, in spite of the counselor's attempts to actively engage, are unwilling or unable to take actions to secure their own safety. And the counselor believes that without this intervention, the individual is likely to sustain a life-threatening injury. I say that too, as we kind of think about privacy aspect to this conversation. The Lifeline treats these conversations to 988 as confidential. The only exception to that rule is, as you can imagine by this definition here, that last line, if the crisis counselor believes that the individual is likely to sustain that life-threatening injury, perhaps to themselves or others, then of course, that could involve contacting emergency services where information could be disclosed. And I'll talk a little bit about why that is the case. It's primarily based on research. So research has shown that ambivalence about dying by suicide is generally present until the suicide is avoided or a death unfortunately occurs. So next slide, please. So just on the same line with that research, it also shows that suicidal thoughts and emotional distress can significantly impact cognitive functioning. So it can quite literally prevent you from considering any other action outside of reducing your own psychological pain. And our crisis counselors are trained to ask evidence-based questions, that is through this research. And this policy is in alignment with the practices of other organizations, including the American Association of Suicidology. Next slide, please. So looking ahead, we're always looking to revamp this policy along with all of our policies, but we are making some changes to the policy in 2022. So be on the lookout in the coming months. And these are just a few examples. This isn't all encompassing. So again, please be on the lookout. First thing, requiring crisis centers to investigate and prioritize alternative interventions to a 911 call. So this is just really making sure that crisis centers, prior to a 988 call coming in, they know all of the resources that are available to them. They know mobile crisis teams that are available. They know anything that might be available to avoid eventually, connecting with 911 and, law enforcement. We also want to encourage those crisis centers to work with their community, and that includes, in this instance specifically, social justice groups and behavioral health organizations. There are a lot of great groups leading this effort, talking about this work, and they need to be involved in that conversation. And lastly, some specific things for the crisis counselors in these moments. We're going to have them undergo training associated with the physical dangers that law enforcement can have to a person experiencing a mental health emergency. Also the emotional impact that, an involuntary intervention can have. And lastly, I think this last piece doesn't get brought into the conversation all that frequently, but it's extremely important, is even the financial impact that, an involuntary hospitalization, an ambulance ride, ER visit, whatever that may be, the financial burden can certainly be significant for folks. Next slide, please. So I just want to share some resources. Had to fit quite a bit of information, very quickly here. So just want to make sure folks have the resources if they want to, do their own research, look at this a little further. And I mentioned some of these things here, but the first two, just the Lifeline and SAMHSA FAQ, some general language on 988, but also some more specific things around privacy, around police involvement, in emergency services. So some really good stuff there. I mentioned that American Association of Suicidology accreditation. If you're curious on that, there's the link there. I mentioned a couple of our committees that help guide our policies. And if you'd like to learn a little bit more about, the composition of those committees, there's a link there for our Lifeline Standards, Trainings, and Practices Committee. The NINA Suicide Prevention Standard, just some really great stuff on 911 and 988 interaction. And the last link here is just really some empirical research, is what helped form these policies, and kind of the rationale behind that. So thank you again. This is extremely important work. The conversation certainly does not stop here. This is really the beginning, and, be on the lookout for that policy. Thank you. I will now turn it over to Steph Pasternak from NAMI.
Thanks so much, Jordan. And I want to thank AFSP for the invite and for hosting this conversation. Again, I'm Stephanie Pasternak, Director of State Affairs at NAMI's National Office. Next slide, please. Thanks. So it is my pleasure to introduce you to the Reimagine Crisis campaign, what it is, and how you can use it to get involved in all things 988 advocacy. Next slide, please. So this initiative, led by NAMI, is bringing together a diverse group of leading organizations to fundamentally reimagine our national response to people experiencing a mental health, suicide, or substance use crisis. Together, we've been working to bring attention to the implementation of 988, the new 3-digit number to contact the Suicide and Crisis Lifeline that you've heard so much about, and crisis services to engage policymakers at all levels through our networks. Our main push is for leaders at the national, state, and local levels to take bold action to implement policies, funding, and programs that are needed to build a true crisis response system that doesn't rely on law enforcement or the criminal legal system as the default first responders we know today. Next slide, please. So, of course, no one person, no one organization can transform crisis response alone. So Reimagine Crisis has truly been a collective and cross-sector effort. Here you see some of our partner logos. They don't all fit on one slide. We have well over 40 partner organizations ranging from leaders in the mental health and suicide prevention space like NAMI, AFSP, National Council for Mental Wellbeing, to name a few, to partners in the broader healthcare space like the American Academy for Pediatrics and American College of Emergency Physicians, and law enforcement partners such as major county sheriffs of America, as well as organizations that look to address the unique needs of specific populations like the Trevor Project for LGBTQ plus youth, and the ARC, who represents people with disabilities. Again, just a few partners, just wanted to name a few. Next slide, please. So around the official launch of 988 on July 16th, Reimagine Crisis Partners, we leveraged several promotional opportunities to get the word out on 988, including placing what you see here, which is an open letter in the Washington Post. And what this ad really did was explain how July 16th is the starting line for 988, not the finish line, and called on policymakers to continue to act to give this system the thoughtful planning and resources that it deserves. Next slide. Another activity that we've undertaken is to find out what the public knows on 988 and what they think about the state of crisis response today. So we partnered with the Ipsos polling firm and released polling results in June that found a general awareness of 988 was pretty low. In fact, leading up to that nationwide launch date, 77% of folks had never heard of 988, and only 4% of Americans were at least somewhat familiar with the number. Next slide. And although people didn't know much about 988, when we explained the purpose of 988 and the 3 pillars of a comprehensive crisis system, we found that people overwhelmingly supported these actions. For example, 86% of people believe that when someone's in a mental health or suicide crisis, they should receive a mental health response, not a police response. 91% of Americans support the creation of 24/7 mental health, alcohol, drug, and suicide prevention call centers that are really the backbone of 988 right now. Over 4 in 5 people supported state level funding and federal funding for 988 call center operations and related crisis services. And I know we talked about the 988 fees earlier and how that is a really sustainable source of funding that states need to act on to leverage. Well, 3 in 4 people said they were willing to pay some amount of money on their monthly phone bill to fund their state's 988 crisis system, especially when they learned that was how 911 is funded today. Next slide. So now I want to talk about what Reimagine Crisis has to offer you. I highly, highly encourage you to visit reimaginecrisis.org, as it's a great hub for a lot of info on 988 and tools for advocates. Next slide. So let's walk through some of these resources. Next slide. So you can visit reimaginecrisis.org/crisis response to get an overview of 988, how we got here, its promise, key action steps for policymakers, and more. Next slide. You can also find some helpful short videos explaining what 988 is all about, including a video from NAMI that you see on the left-hand side there, which breaks down the 3 pillars of an ideal crisis response system, and a PSA from AFSP on the right-hand side that features NFL quarterback Dak Prescott. Next slide. So on our reimaginecrisis.org/map page, we have a comprehensive 988 state bill tracker that is updated in real time. So if you want to find out what kind of legislation has already happened or is pending in your state, check out that map, see where your state is in terms of passing the 988 model bill we've talked about, and also check out our legislation chart that lives underneath the map. That provides more info on other measures beyond model bill measures, such as state appropriations related to 988. Next slide. And you saw from our poll that, the public's awareness of 988 is fairly low. So you can help get the word out to key audiences about what 988 is and what action is needed by downloading some of our social media shareables found at that webpage. And these have been pretty popular online, so I encourage you to check them out and share them on your social pages as well. Next slide. So this whole effort has really been powered by lived experience, people who have direct experience with our crisis response system. So at reimaginecrisis.org/stories, we have actually an online story collection tool. And we'd love to hear from you about any experiences you or a loved one may have had with the crisis response system, whether it's good or bad. And even if it was a negative experience, it'd be great to hear what would have helped you or your loved one. So we have a really simple online form that you can fill out and share that if you're willing to. I know sharing stories sometimes can be very hard and challenging, but having these stories really helps us to show how important having a comprehensive crisis response system is, and informs exactly what we need to ask for in our advocacy. Next slide, please. Just some other resources you'll find on the site. There's a collection of some of the latest reports and guides for federal, state, and local policymakers. There's a link to some take action opportunities to write your congresspeople about the different federal actions. We compile 988 news clips regularly. We have our Reimagine Crisis principles that we've coalesced around with all of our partners. And we've held a couple virtual advocacy events, including a week of action and a day of visibility. You can find those event recordings on the site as well. Next slide. And all this hard work is paying off. We've had a huge increase in our web traffic to reimaginecrisis.org, a lot of new visitors, a trend of people staying longer on the site over time. Our Washington Post homepage takeover had 500,000 impressions, and the campaign continues to get some national, state, and local media hits as well. Next slide. And so just to wrap up, I just ask that you can help us keep up the momentum by visiting reimaginecrisis.org, using the educational and advocacy tools there. If you happen to have any questions for NAMI or the Reimagine Crisis campaign, you can reach us at reimaginecrisis@nami.org. Thanks, and I will turn things over to Joanna now.
Thank you so much, Stephanie. That was really, really informative and helpful. And thank you to all of our guests for joining us today. I just want to encourage everyone to visit our 988 webpage, which includes further resources and background information, and to check out our Action Center to participate in our Suicide Prevention Awareness Month actions by reaching out to your members of Congress. You can also connect with your local AFSP chapter or local NAMI state organizations to get plugged in with their advocacy efforts. We have links here, and these slides will be available on the website shortly, as others have mentioned. Thank you to everyone who's tuning in to learn about 988 and to join the effort to improve access to and the quality of our country's crisis response system. We really do rely on advocacy and our many dedicated volunteers to effect the change we need to ensure that 988 can meet the demands of anyone experiencing a suicide, mental health, or substance use crisis, so that everyone has someone to call, someone to respond, and somewhere to go when they need it. Thank you all so much.